Assalamualaikum warahmatullahi wabarakatuh. We are from Group Adrenaline. Today we are going to present about Obsessive Compulsive Spectrum Disorder or CSD and post-COVID-19 on challenges and solution. According to Helen, King and Hollander, 2003, Obsessive Compulsive Spectrum Disorder can be defined as an essential term that share main obsessive compulsive symptoms. The symptoms of OCSD is not same exactly as OCD, which are highly comorbid with OCD. Dissociative disorder has confirmed that higher rates prevalence in patients of OCD for some OCSD. There are various theories that have been implemented to explain why obsessive compulsive happen. The theory that we choose for our assignment is cognitive theory, which explain the person who have this obsessive compulsive is because of false belief and thoughts. Sika et al. 2006 conducted a study that about how cognitive theory can be applied to obsessive compulsive in different culture. In this study, they study cognitive theory to people who have obsessive compulsive disorder at Greece, Italy, and United States. The result shows that the cognitive theory can be applied to the obsessive compulsive. According to Alhort and Kalentroff 2013, in their article, they said that the cognitive theory can be one of the intervention to treat patients with obsessive compulsive disorder. Therefore, based on this research, we choose cognitive theory as the theory to explain why obsessive compulsive happen.
Assalamualaikum warahmatullahi wabarakatuh, and hi, my name is Sabirah binti Shamsuddin. My metric number is 1820454. Today I will talk about theories practice in daily life part. As we know, right now all over the world were attacked by coronavirus COVID-19. In March 2020, World Health Organization was categorized coronavirus COVID-19 as a pandemic. So the situation shows great potential for negative impact on mental health, especially patients with OCD or OCSD. The increased anxiety about the virus induced obsessive fears in some people with OCSD or OCD, plus triggering harmful compulsive action. They will always think all about coronavirus. I just found an article which is an OCD patient share his experience during the pandemic. His name is Sam Dylan Finch. He was published his article on Healthline. He said that touching anything feels like willingly placing my hand over a stove burner. Breathing the same air as anyone near me feels like inhaling death sentence. So based on his experience, it shows how OCD patients may suffer with their obsessive thoughts. According to Bacher, Minika, and Hooley, the most effective treatment for OCD is a cognitive behavior treatment, which is CBT, that called exposure and response prevention, which is ERP. ERP refers to exposing yourself to the thoughts, image, objects, and situations that make you anxious or make you trigger, and it starts your obsession. As we know, the virus we cannot see. So when we cannot see, we don't know if the virus is around or not, and this will make the OCD patient OCD patient will keep on thinking, and they will become paranoid because they don't know where the virus, and they keep overthinking. What if the virus is on the doorknob? What if the virus is at their food? So this is really made them tiring, and it's really hurt them. So to practice CBT, which is particularly ERP, according to Feinberg and others, the clinician suggests the patient need to review and risk access to the CBT plan. During this pandemic, CBT needs to consider whether it fits on government safety guideline. Like in Malaysia, it is called Standard Operation Procedure, which is SOP, which means that the CBT plan need to in line with the SOP that government suggested, which is keep social distancing 1 meters, always wash your hands and wearing mask. According to the clinician, also the OCD for OCD patients with contamination fears and cleaning or washing compulsions, ERP techniques you need to be sensible, adapted, or maybe they need to pause because as we know, ERP is the patient exposed with their fear of thoughts or image or anything. But for this pandemic, it may be really trigger them because we don't see the virus. So the clinicians instead suggest helping the patients and also trying to prevent the patients from deteriorating. For example, encourage OCD patients to restrain their compulsion as far as possible and focus on technique like behavior action and activity scheduling. So this technique can help to prevent deterioration and as well as with depressive symptoms. Treating them with ERP may harmful for them. Meanwhile, for OCD patients whose exposure are not contamination related, the clinicians said that the patient can continue ERP treatment plan as long as they follow the SOP by the government. They can also try to walk around at their outdoor home area and maintain 1 meter distance between others. So just follow the SOP. But however, we need to take note that physical distancing can increase symptoms of anxiety and depression. So ERP can increase distress. However, it also can increase depression temporarily. Therefore, the patient's mental health state must be keep on checking and check wisely. That's all for me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nafitra Atika binti Syamsuddin. My matric number is 1817208. OCSD from Islamic perspective is known as waswas al-qahri. Waswasah is the Arabic term of the obsessive compulsive, which means the evil spirit of Satan. There are two types of waswas al-qahri. The first type of the waswas al-qahri is the most common one among Muslims, where it's involved the negative whisper but did not disrupt our daily life. People are actually experiencing this every day, but we can overcome it by ourselves by always remembering Allah Subhanahu Wa Taala and try our best to not follow our desire. The second type of waswas al-qahri is more serious and similar to the OCSD symptoms, where people who suffers from this type usually show an unusual acts, extreme behavior in their daily life, and especially in religious activities. Among common reported symptoms are obsession of the security, sexual acts, aggression, and religious rituals such as ablution, prayers, and purification. All of this happen because of the obsessive thoughts such as belief, purification, worship. Some people may think that this is a good thing, where they think that obsessive thought actually can lead them to be a good Muslim. However, this is actually contradict from the Islamic teaching. For example, when they are about to perform solah, they tend to take ablution for many times until lead to the waste of water and time. Therefore, I can conclude that we need to know how to differentiate between the first type of waswas al-qahri and the second type of waswas al-qahri. Because the first type of waswas al-qahri, we can overcome it by ourselves. However, the second type of waswas al-qahri need to seek help from the professional help. We should try our best to always remember Allah Subhanahu Wa Taala and try to avoid any obsessive thought, as Allah has mentioned in Quran Surah 7 verse 201. Those who are always remember Allah Subhanahu Wa Taala, when Satan try to prompt them to do something, they can see it. Thank you.
Hi, Assalamualaikum everyone. My name is Adib Shatira binti Ahmad Sabri, metric number 1813734. So for today, I'm going to present on the reflection part, which is project A, and our group had been given a task on obsessive compulsive spectrum disorder and post-COVID-19 challenge and also the solution. So we managed to discover that during this pandemic, there are very high impact on every people around the world, especially those who have OCSD, because they are worrying about their cleanliness, they are worrying about the dirtiness, they are worrying about everything around them. So from this project, we learned that this OCSD can be understood through the cognitive theory. This is because by time to time, we know that people will face the intrusive thought that makes someone distressed. Same goes to those who have the OCSD, but they are more worse. This is because their repetitive action, their unwelcoming desire, unwelcoming thought, they are thinking that the virus is everywhere, make them become more scared, make them become more obsessive toward the virus. So from this, we come up with the Islamic views, which is we need to become more close to Allah and avoid the evil whispering, because we can understand this OCSD as waswasa, like when you are going to pray and then you become waswas that am I have an ablution with me? So you are become more waswas, so you need to concentrate yourself. So I think when we understand the Islamic view, so when we are praying, we can have a really good attention when we are praying, so that we don't focus on our obsessive. Through this, we can actually be a better person, and we can avoid in doing sins. It would be the best time for us to reflect our action and avoid doing sins and also be a better person. So to come up with this argument theory on OCSD, we also analyze and evaluate which theory that could be the best one to understand this OCSD. We also compare it with the psychoanalytic theory and also learn theory, but we know that this cognitive theory is the best way to understand this OCSD. So we use this theory, we prefer this theory because it emphasizes on how people think and how they can understand their disorder and learn how to decrease their obsessive compulsion time by time, so that they can know the reason why they are changing their behavior and why they are obsessive toward a certain behavior. So in conclusion, we believe that this project really helped us to understand regarding this OCSD. So the theories mentioned before, the cognitive theory and also the solution and the challenge and also the Islamic perspective, really help us in understand OCSD really well. So we also come up with the cognitive behavioral therapy, which is gonna help those OCSD reduce the amount of obsession. So in the future, if this pandemic happen again, the main power that should be with those suffer this OCSD is the family and friend, which I think the surrounding is the one that can help those with OCSD. This is because surrounding really make us. The surrounding need to learn and at least give some support and make them relax, so they are not so into the obsession. So I think that's all from us. Thank you.